that is case number 8. Okay, let's have a look at this one. Now, I can't remember this one. Okay, let's have a look. What does everyone think? Just give me some opinions. Tell me what you think. So, youngish patient, from what we can see, maybe slightly overexposed, looking very, very kind of bright white. So, what I'll do, I'll see if I can sort of window it a little bit better. And okay, so one of the things you want to be looking for is whether there's any sort of avulsion fracture around this area. You know, it's not going to be coming from the fibular head, but sometimes you get sort of what looks like an avulsion injury, a bit of fleck of bone. And in that situation, you'd be worried about a Segond fracture. You can get a Segond fracture on the other side, and Segond fractures are important because if you do have what looks like an avulsion of bone on either side, you may be looking at a cruciate ligament injury. A Segond fracture would mean that an ACL injury, and a reverse Segond may result in a PCL injury. Right, so we don't see anything abnormal. A lot of time people miss that there is a patella sitting over here. I've seen properly fractured patella over here, so just be worth looking at. We don't have a lateral view on this one, so it can't be 100%, but that patella does look like it's sitting in the right place. It doesn't look like we can see any fracture. Now, just I'm going to throw out there, if sometimes some people may see what looks like a radiolucent line sitting over there. What would anyone call that if you had like a radiolucent line sitting on that patella? Because I've actually been called about this a few times, and sometimes what you have is a bipartite patella, because you get different ossification. Exactly, you get ossification centers, right? And sometimes you get stippled ossification, so you don't get one, you get like multiple kind of partates. So it doesn't always ossify in the right way. Someone's picked it up nicely. Well done for picking that up. But the other check areas I'd like to do is go and show you like the medial femoral condyle. Now, the thing about the human body is that the weight of the body goes down the medial aspect. The inner side of your body takes most of the weight, which is why that lateral, the medial plateau, tibial plateau is larger. The meniscus is larger on this side because it takes more weight. And actually that results in the increased possibility of actually having what is known as an osteochondral defect in the middle third of the medial femoral condyle. So be very careful that you can't see any sort of abnormalities located within this region. Now, I can't convincingly say I can see one, but you may identify an osteochondral defect. But actually, you know, let's zoom in a bit. And there is a sort of radiolucent area over here. Right, so which kind of brings us on to what someone has mentioned, right? So someone has said there could be a loose body located within the joint. Hopefully everyone can see that. Can everyone see that? So I'm going to get that pen out. Can you see this little kind of loose body that's sitting over here, right? So you've got what looks like a loose body sitting within the knee joint itself. But because we're looking at a 2D representation of a 3D structure, it's hard to know whether it's in the anterior knee, the posterior knee, whether it's in the middle of the knee. But then, you know, where did this piece of, you know, loose body come from? So sometimes you've got to look for donor sites. In the context of injury, you may have a fracture of the medial or lateral tibial spines, but those tibial spines look okay. And if I do a bit of windowing now, I don't know if I can convince you, but that area there doesn't look quite right. It looks like there's a bit of a radiolucency over here. And so because remember, it's like a curved appearance to that femur, you may have, so the stages of osteochondral defect is like stage 1, stage 2, stage 3. The final stage is where you actually get dislocation of an a defect of the bone, and that kind of just flies off somewhere. So there is a possibility that this may be the donor site sitting over here, maybe the donor site of this fragment of bone, because there's no fragment of bone sitting over here. And this patient's come in with, I think it was a lock knee. So that's just something to be aware of it. The medial femoral condyle, and sometimes you may have very subtle appearance to what is essentially an osteochondral defect. And that'll be one of the things that I'll be worried about on this particular X-ray.